Hello, everybody, and welcome to Your Quality of Life Healthy Alternative. Today, I'm having the pleasure, the absolute pleasure, to have my friend Fallon Jordan on the call. Fallon is a brain health super coach from the Amenclinics, and I'll let her tell herself how she got into that job and what she's doing. Tell us about it, Fallon. Welcome.
So I've been with the company for about 9 years now, and I just woke up one day after being in the service industry with my bachelor's in psych that I didn't think I was going to do anything with, and just received this divine message that I was going to get a job in my field. And I started at the front desk at Amenclinics and just fell in love with what we do, fell in love with our patients. And then I started doing some intakes, which was really special and wonderful just to hear people's story and kind of validate what they've been through, and also validating that they're in the right place and that we're going to figure out why they're suffering. And then I did aftercare and coaching for several years. And then after about 7.5 years working with patients in the clinics, I felt called to do something bigger. So kind of like what we're doing right now, like instead of working one-on-one with people, if I can educate and share some of these experiences that I've learned for myself, and then through our patients, we can help more people and have people start thinking about, what if mental health is really brain health? What if anything and everything that is going on in your life that is not getting you the quality of life that you want has to do with your brain, and we can make it better?
I think that's so important. And thank you for adding at the end, and how we can make it better.
Exactly.
I found many people, and you probably heard that a lot, still think, oh my God, I'm depressed. Now I have to deal with my new normal, take medications for the rest of my life. And it is often just not true.
Right. So I'm super grateful that now I am the community and curriculum director for Amen University, which is our online courses, which everyone can have access to. And we also do have a new dashboard in there where, me and the Amen University staff are going to answer questions and really just help and reach more people. So I am just super excited to be a part of it. And it's just been kind of a mission for Dr. Amen and I for a long time to really have Amen University grow into something special. So I'm just super grateful that I get to be.
As a long-term follower and fan of Dr. Amen, I can say it's a great resource. The Amen University, I promote it all the time, and I'm very fortunate to be able to teach some of its courses as part of the Brain Revolution. That I love the name. It's so important that people realize there is something they can do themselves besides just taking medication. There's nothing wrong with it if that's the right ones, but there's something else they can do to help themselves to feel better. Isn't that true? And I love what you're doing. And having met Daniel even shortly on a Zoom call, I noticed how humble and friendly he is.
He is. He's the reason I'm here. He's completely changed my life. It's so funny. We did our big Amen University Max, which is the new community platform for the all access pass, the other night together. And they actually edited out the first couple minutes of the intro because just introducing him, I started crying.
Aww.
My whole life is so different because of him. And if I had known, and my family had known earlier, before, my first scan was at age 27, I think. If I had known earlier, especially 15, 16, where all those changes started happening from my concussions, I went from being this very sweet, compliant, straight A student to a total freaking nightmare. My parents would have brought me in sooner. So that's why
it is so true what you're saying. This changes lives. The earlier people hear about it, the better it is, because so many people suffer in silence, suffer because they think there's nothing else out there. And I always encourage people, don't stop searching. And I love that you're doing what you're doing and supporting Dr. Amen in his work. And it is so important that we do this work. And I always say he's the smartest guy that I know, but he's also extremely funny.
Is
when
very
I
funny.
teach his courses, I sometimes show part of his videos and I just chuckle and laugh, and it is amazing. So it
I
is
love
a
his
true
sense of
pleasure.
humor. Like it's with me too, because sometimes they'll say something and then you're like, oh my God, that was like really funny. And like it takes a second sometimes, which I always like joke with him when I get to see him in person, that it's like a cognitive test. Like you never know what he's going to say and like how he says it. So funny.
Yeah, well, most psychiatrists let balloons go and see what happens.
I know, right? So funny.
It's kind of funny, and if they realize it, and I know Daniel does it, Dr. Amen does it, it is amazing. And so he's not just a very smart person, he's a good writer, he puts it in a very good system. He is a trailblazer in the SPECT imaging, he truly is. And
Absolutely.
I really feel this movement needs to take on a bigger growth.
Absolutely. And that's what I used to say day in and day out when I was doing intakes. And even now, just from a different platform, why do I not know about this? And I'm like, that's why we're doing what we're doing. We need to spread the message. But, you know, psychiatry has been practiced the same way for a very long time. And the definition of insanity is doing the same thing over and over and expecting different results. And so
Exactly.
drastic change, which is what we're doing. But I mean, I don't know how many of your listeners watch TV. I watch the least amount of TV as possible. I watch comedies only on Hulu and I refuse to pay for no ads. So I sit through the commercials and they're all pharmaceutical. And there's only 2 countries in the entire world that are allowed to talk about pharmaceuticals and sell them through marketing. So when people think of that, it's like, whoa, just because I'm depressed doesn't mean I need an antidepressant. And I'm like, no, that makes no sense. Like we're getting sicker and sadder every year and they keep coming out with more meds. It's like, I'm really bad at math, but like, think about it from the big picture perspective. There has to be a different way. And it's by looking at the brain, looking at your genes, looking at your gut biome, like all of the things that you do, which I'm so grateful for you doing that work, because it's not just about a symptom, it's about a whole person. And it's about everything that they're made of, every particle, and measuring as much as we possibly can. And we can measure pretty much everything now, right?
You can measure a lot of things. We measure too many things. Sometimes we measure things that don't make a difference, but scans do make a difference. And that's
you go to a general doctor, they do a blood panel, right? Go to you.
I don't do blood panels. I just interpret them. I'm no longer licensed, so I'm just coaching myself. But
Gotcha.
I use my background as a physician, of course, to help them understand what's going on, and that sometimes just because their blood comes back normal doesn't mean it's all okay, because often important blood tests are not done. There's millions of blood tests available, and you can't pick everything because it's just not affordable. You can't do every diagnostic test. Nobody can do that. It's not affordable. You don't have enough time in a life to dissect the body in that way. And it doesn't make sense. We have to follow an algorithm. Dr. Amen has developed one. I follow it myself because I love it. Those questionnaires that the Amenclinics do. And if you're listening to that and you can travel to one of the Amenclinics and get your brain scans and do the whole process, I highly recommend it. I refer clients there all the time. Some can afford it, some can't. And it makes a difference, even if you don't believe it.
Yeah, and that's the thing. I used to have patients that are really anxious, and I'm like, what are you anxious about? It's one of the first questions we ask in general psych mental status exam. They're like, well, I'm either worried that my scan's going to be healthy and I'm crazy, or I'm going to be scared that my brain is so unhealthy, there's nothing you can do. And I, every year got to say, I've been here X amount of years. It's never been the case. We're all somewhere in the middle. We all have anxiety. We just need to have a healthy level of anxiety, which means we're caring about our brain and we're making decisions based on, is this good for my brain or bad for my brain? How is this going to impact my health? Not just today, but tomorrow and the next day, and those kinds of things. You know, if I cheat with gluten, it's usually the next day that I feel like sluggish and depressed. But then the couple of days after that, I still feel really just foggy. And I'm like, if those were the 4 days that, you know, I was supposed to be doing some really hard inner work or have a big project coming out for Amen University and I'm not at my best self, like I'm disservicing myself, but other people. And my whole purpose for being on this planet right now is to help empower other people that you're not stuck with the brain and the life that you have. You can make it better. It's not an overnight change and it's not super easy, but it can be a little bit easy. It can be baby steps at a time, just incorporating different things like supplements and making sure you're getting enough oxygen to your brain and making sure you're taking care of your gut. And then you can do some of the other work with like a therapist or a deeper dive with a nutritionist, that kind of stuff.
Yeah, and that is actually often enough to work on the physical part. And I compared with the cell phone, and I think Dr. Amen started to do that too, because it's just modern. The brain is kind of like a cell phone. We have hardware that has to work, so the physical functioning, we have software, the thought patterns, and we need the internet, something spiritual that connects us to the higher power and the purpose. So as a cell phone, we can't work if one part is broken, and we have to fix it from outside. And if you give a cell phone a pill, which means a special app, if the chip is broken, it still won't work. And you can try to download the app 10 times. If the chip is just not powerful enough, it won't work. So you have to upgrade your brain, give it some oils for the oil change, omega-3s, and the right nutrition. And I love that. And I love the way that Daniel simplifies neuroscience, brain health. Although, of course, he knows all the lingo, he doesn't go into it unless he has to.
Right. Yeah, I love that. And he has a lot of self-control, and I hope to be at that level because I still get extremely fired up, but I'm not in the limelight and I don't have MD, so I don't have to worry as much as him, but still it's very stressful.
Oh, I have brain envy. I want a brain like as good as his. I won't get it. Probably I'm 60 already, but you never know. As
yeah, you're a few years younger than him.
I'm about 6-7 years younger than him.
Yeah.
So I have a chance. Not quite. He's doing the things for a longer time than I ever will, but it's fine. And I damaged my brain by having taken medications for psychiatric illness that I thought was permanent, and it wasn't. And it is amazing. It is really amazing how much clearer you think when you're doing the right things for you. And it doesn't have to be rocket science. And it's individually different. And everybody that here says, I want to encourage you, don't give up. It's never too late to start living your best life. I heard from a 38-year-old client who told me, oh, I can't start over, I'm too old. And I said, you're too old? I started over. I had my nervous breakdown at 38. I started over at 45.
And to me, that still sounds so young.
It's never too late.
Definitely not. One of my favorite patients was 85 when he came in.
Yeah.
And he was super compliant. He said, I'll do whatever you guys tell me to do. His brain was actually in not bad shape, even though he got an Alzheimer's diagnosis, and we reversed it to mild cognitive impairment.
It's impossible, conventional medicine will say. We know it's not. And often in the history of medicine, trailblazers have been denounced, laughed at, and left on the side for 20 years. And that is a shame, because that information, even when Semmelweis introduced hand washing in surgery, how many lives could have been saved?
Right.
Doctors had adopted that right then and there instead of 20 or 30 years later. And when will they adopt a change in psychiatry to help people prevent Alzheimer's as much as possible? And I read the book by Dave Bredesen, which does a similar thing as Dr. Amen.
Yeah.
Oh my God, it is possible.
I love him.
Yeah. It is amazing. And it is so important to bring the message out. And that's why I'm so grateful for the opportunity to teach his courses to other people that need to hear the message. It's not true that you are helpless, hopeless. Right? And you see that every day. You see it in people. I wish I wouldn't be here in a province where there's not much interactions, but it's an opportunity to reach out to the people around me and in the further world that don't know that yet.
Absolutely. Yeah. There's always hope and healing for sure.
And knowing a lot about Daniel Amen, of course, not as much as you, because you know him in person and intimately, more or less. I am always surprised when I talk to people and say, you should read the book, Change Your Brain, Change Your Life by Dr. Amen. Who's Dr. Amen? You know, I asked my own psychiatrist a few
So
years back
frustrating.
that I like the work of Dr. Amen. Same question. Who's Dr. Amen? I said, he's a psychiatrist like yourself. You should read about him. Oh, okay. I don't know if he did or not. Sad.
Yeah, it's very strange. That was definitely the hardest part of working with patients was me, just, someone with a bachelor's degree that just believes in what we do and has living proof that it helps and what we do works. And then being like, why is my doctor not supportive? I'm like, I can't read their thoughts, but you're paying them to make you healthy. And if they're not going to get on board with what you feel pulled to get healthier, which is coming through this Amenclinics evaluation process, probably should fire them.
Right. And I mean, the problem here in Canada is we have, of course, a public health system. So
Yeah.
doctors are paid. Many people have private insurance that pay for medications. They will not pay for a brain assessment or coaching or the assessment in the Amenclinics, which is unbelievable. It would save them tons of money, but it's just not in the system. It's a shame. It's sad. I'm trying to change it at some point.
Yeah, I mean, it's frustrating here too. I mean, the CEOs of the major insurance companies here make billions of dollars a year keeping people sick.
Mm-hmm.
So it's
there are major financial interests against methods that really save monies and maybe even save people from having to spend thousands on chronic pharmaceutical use.
Yeah, I mean, it's a very bigger issue. And I'm so grateful that the first time I saw my brain put me on this path, and the most important thing that has come out of it is my spiritual health. And if I didn't have that, I would be stuck where I used to be, which is, why are people so greedy? And why do people get pleasure from making people sick and homeless and thrown in jail for things like, but I just, it's part of the human experience, and the people that are running companies like that are probably not feeling great too. So I try to have compassion for them and just do the little bit that I can to empower people that you don't have to go that route.
Yeah, that's all we can do as humans. And
Right.
I like that you say it that way, because it is so true. We have to accept reality.
Mm-hmm.
And I like what Dr. Amen says about positive thinking,
Yeah.
that it doesn't make any sense because we have to think realistic. That is so true.
Definitely.
Because if you tend to have Alzheimer's in your family and you go around and think to yourself, I'll never get it. Well, while you are stuffing yourself with fast food, smoking dope and whatever, and drinking.
I know, right?
alcohol.
It's like you're just feeding into that. And through the Bright Minds acronym, we know that your genes is the only risk factor that is hardest to change. You can still figure that out when you have the information. I mean, I got assessed through Dr. Amen and Dr. Bredesen's algorithms at 32. And I know all my risks for Alzheimer's at 32. And thankfully, I have, great genes, even though I was told everyone in my family has Alzheimer's and will get it. But it's because of the other risk factors, just making really horrible decisions.
Yeah, and I see sometimes people put in a nursing home with Alzheimer's that don't even have Alzheimer's and could be helped. Have you seen that?
Yeah, I've had some patients come in that for various different issues, various different ages, and the person coming in with the patient was actually healthy, but the person dragging them in was actually the one that was unhealthy and toxic. So that was a great learning lesson in compassion and just whatever we can do ethically to make sure that there isn't abuse going on and reporting it. But yeah, like this whole thing about, your parents raise you, hopefully they're good parents, right? Then you can take care of them when they need you versus like throwing them somewhere just because you don't want to deal with them. It's very strange. Like there's no other cultures and countries that treat their elders the way that a lot of Americans do.
And I mean, many people tend to accept that as they age, oh, well, you will be forgetful and eventually get Alzheimer's. It's just not true. Just because you're older, you don't have to get demented if you do live in a brain healthy way. People don't understand it. They just accept, oh, well, I'm getting older. I'm getting sicker.
I mean, Dr. Amen's dad didn't start listening to him until he was in his 80s.
Yeah, I saw this story.
He became healthier and feeling better than he had in decades. So, I mean, it's definitely never too late. And aging is nothing to do with feeling like you have to be forgetful. I mean, the whole point of being on this planet is to learn and connect with other people. And that's based on memories. And so the concept of us thinking it's okay to lose memories is very sad to me, because that's the whole point of us being here.
You are so correct, because when you look back in centuries, the elders were revered.
Right.
As the average age of death was younger, but what did people die from? They died from infectious diseases that we nowadays can treat or prevent.
Right.
But if they got older, yes, some people had cancer, some people had whatever diseases. But though most of the older people were able to look after themselves and had excellent memory and were considered elders and wise. So
yeah, and they were giving their grandchildren and great-grandchildren advice and helping them grow. Like it was just this beautiful process.
Shouldn't it be the new normal that as elders or as growing elders, I'm growing older, in 20, 30 years, I'll be 80 or 90, I'll be old in the conventional sense. As growing elders, we need to understand that wisdom is our choice and we don't have to end up demented. It's not an inevitable fate if you do the right things.
And I think a lot of it too, just culturally, like our weird obsession with like age and the aging process.
Beauty, youth. I mean, youth is fine. Kids are creative. They have energy. Hey, I'm 60. I still have energy.
Yeah, that's what we're meant to do, is like have fun. And, when people do get to an older age and they don't want to work as much, or they do end up retiring, the whole point is to spend more time with your family and travel and like take care of yourself. Why would you want to feel the sickest during the time that you're supposed to enjoy? Like I personally, one of my weird things is like, I'm 35. My whole life, I have always been just like, I love hanging out with elderly people. I just always have. I love it. It makes me so happy. I feel like I'm just sucking in all the free wisdom and like things not to do and to do in your life and stuff. And so I can't wait to get older. And like, I think the aging process is one of the most beautiful things. And I mean, we look at Betty White, and I also love Cloris Leachman. Like, I still think they get more beautiful with age. And they, before Cloris passed away, she's in her 90s. Betty's, I think, in her 90s now. And they're gorgeous still. It's just a totally different way of looking at it. And when I see people with plastic surgery and like all these things, it breaks my heart, because I'm like, you don't look like a human anymore. Like you don't look you look like a weird version of a robot, which apparently is a thing now. Like you can actually build robots that look the way that you want them to. It's like so bizarre.
In all detail, probably. Yeah, I can imagine.
Yeah.
With plastic parts. Maybe interchangeable. I don't know. It's just weird.
It's very weird.
There is a personal connection between people. People are social beings. Even if you're on Zoom, it's the second best. It's better to be in person. If you can't, Zoom is the second best or something like it. It doesn't have to be Zoom. There's other platforms. But I think many older people give up too early and get lonely. Some people don't have a family, or their family for some reason is too busy, doesn't have want nothing to do with them. I always say you can't choose your family, but you can
Exactly.
choose your friends. Make friends. Have a new family. I have a very good friend.
Absolutely.
She's my chosen sister. We're very close. That's lovely. I love her.
Absolutely. Yeah. I mean, my friends and I joke about like us just being old and hanging out and doing what we do together now. I mean, I'm grateful that a lot of my friends, my family and their family get along and we can do things together. But if, you know, some of them that aren't healthy, like we don't invite them to do things with us because our time together is very special and sacred. And, you know, I'm only going to share my time with people that truly deeply love me for who I am and vice versa.
And that's important because, as Dr. Amen always says, we become like the 5 people we spend the most time with.
Exactly.
And who do we spend really the most time with? You better like yourself.
Right? Be your own best friend. That's what I've been working on.
That's the first thing. So many people beat themselves up and say things to themselves that they never would tell their best friend. Never.
Exactly.
Ever.
Exactly. I love that. And I think it's something that we need to continue saying so people really start thinking about it because we're just always looking for external validation and it really needs to come from us. And that's the hardest work, but it can also be not that hard and it can be really rewarding.
Yeah. And you know, the thing is, Dr. Amen also emphasizes the importance of gratitude, and he always shares the glad game from the Disney movie Pollyanna that he put out of it. And I use it all the time for myself and for my clients. When I broke my knee, I had to be in a cast for a week or two, which wasn't too bad. And I thought by myself, well, I'm glad I can take that splint off at night, have a shower. And then I graduated to a movable and I put on my Facebook, happiness is bending your leg.
I love that. Yeah, there's so much to celebrate, you know?
Yesterday I was at the surgeon. I got the brace off because it's healing well. Well, I take all the good supplements. I know what to do. I do the exercises. And the surgeon looked at me and I said, you have more movement than I ever thought you would have. No pain? I said, not much. And he said, okay, you don't need the brace. And I said, thank you. You made my day. I said to him, and I said, you know, you made my day last time when you gave me a movable brace, and you made my day when you said I could go without it, just being careful. And he chuckled, looked at his residence, and I think I made his day. And that's rewarding. That's what I like to do.
I love that. Isn't it nice to be yourself authentically, but also be that person that can bring joy to other people? I mean,
isn't it the most rewarding once you have done at least most of the work? Your cup is mainly full. There's always dips and you fall off the bandwagon. It's normal. We are humans.
Absolutely.
But mostly your cup is full. It's flowing over. You can give to others. It is the best thing in the world to do that. Isn't it? And I know Dr. Amen does it for the same reason. He shared it in his Dragons book, which is funny, by the way.
I know. I'm like so proud of him in that book. Like I really felt him, you know.
Yeah,
and it was so cool that it came out.
I was really impressed.
Yeah. And then Tana's The Relentless Courage of a Scared Child was also just, I was like, wow, like they're going through this beautiful transformation, and knowing them as well as I do, like really cool to kind of see them be so vulnerable.
Yeah, I listened to his audio big book version, which I was very disappointed that he didn't read it, because I
was going to say, I doubt he would have done that.
It is not quite as good. It's okay. They have a good narrator, but it's not as good as himself, of course. So I couldn't really feel through it, but I thought of it.
I'm gonna have to check it out. Maybe that could be my next job request. Like, hey, how about I read your books for you?
Yeah. I mean, it would be nice.
I read them anyway. I have a good voice.
Yeah, well, who knows? Yeah, why not? I highly recommend, if you haven't read any of Dr. Amen's books, check them out. Any of them are really well written, easy to understand, helpful, and just good. And they're affordable for anybody. That's important, because
I mean, for what's in there, I mean, I'm surprised we don't charge more, because it's your whole life, honestly, can be changed by reading one book. It's really,
Yeah, and the promise in his mega bestsellers, Change Your Brain, Change Your Life, is not out of the world. It's the truth. If you do what he says, that's the trick. If you do what he says, your life will change. And as a coach, we're helping people actually put that into action. So that's a rewarding part.
and I mean, I've seen it. I got scanned just 3 months apart and saw how much healthier my brain was just after 3
Wow.
months. So it's the change is, it's there. Feel
Yeah. I wish I had a spec machine here.
I
An
know.
Amenclinic, at least in Eastern Canada, would be awesome. But hey, not so far. Maybe in the future. Future is bright. The future is bright for you. And I'm so proud of you for what you achieved, coming through your challenges and blossoming more and more, coming out of the ashes as a phoenix.
Yeah,
And
my life
God
is
knows
not
where
good.
life will take
When I
you.
started at the clinic.
Nobody thought about it, didn't we?
Yeah, I look at pictures and I'm like, I looked a little, like my face seemed a little skinnier, but I'm like, I don't even know who that person was. Like, she's so and like uncomfortable. Like, even the clothes that I was wearing, I'm like, I can't believe I dress like that. Like, it's so weird. And it was only, 9 years ago.
Isn't it something how people can
Crazy.
change? So people can change. Change is possible, but you have to work on it. You have to want it. And as Dr. Amen always says, we can change anybody's brain. You have to do it yourself.
Absolutely. And change is hard. We're not really wired for it to be easy, but once you just do those little steps, I mean, even after 30 days in a new routine, it's going to stick. We need to use the information about the brain to our advantage, which is, incorporating new routines and small steps that lead to long-term, daily habits.
Yeah, and it is very important. And so many people go to Google, find everything out, maybe buy the books and never read it and never put it in action because they feel so overwhelmed by the amount of information. And those I really encourage, go to the Amenclinics, get your assessment, brain scan, and plan. And if you can't go to an Amenclinic, hey, contact me. I'll do the same thing on a little lower level and give you a good plan too.
Definitely. Yeah. I mean, I've never had one patient out of the thousands I've helped that wasn't overwhelmed with their treatment plan. But that's the whole point, right? Is like you finally realize what you need and why you need it and how to do it. But we need to take, we just need to take our time and implement it at a pace that makes sense for you.
I think really the important part, what you get in the Amenclinic and what the providers that know the Amen method, like myself, do also, is to develop that plan that shows them the way to go on. And then we as coaches help them to actually walk and give them a little shove in the butt if they need that. And many of us need it. I need it too. When they fall off the wagon, give them a hand, pull them back up. That's what we do as coaches.
Exactly. Yeah.
And people need that and people want that if they know how much difference it will make. And it's so rewarding when you talk to somebody that comes to you, I don't know if you can help me at all, but I want to get better. And then after a few months, they smile and laugh, make good decisions. Wow. You've seen that many times, didn't you, Fallon?
Yeah. And I miss that, when patients would come back for their follow-ups in person and I would get to see them, it's like, I'd have to do, like, I'm a very good person, like with faces and names. And sometimes I would have to take a second look to see if it was them. Cause like, they looked so much healthier. Yeah. Like their skin looked better. Their hair looked better. They were dressed better. Like they just overall looked like a different person, just a healthier version of themselves. And that's just the coolest thing to see.
Yeah. And who doesn't love what Dr. Amen says? Nobody wants to see a psychiatrist, but everybody wants a better brain.
Right.
And it's awesome. So Fallon, I thank you so very much for coming on the show. You're an awesome person, inspirational person, and so is Dr. Amen.
Thank you. I really appreciate it. This was so fun.
Thanks. Have a wonderful day.
Thanks so much, you too.
Bye.
Bye.